Hello, ladies and gentlemen. Today we'll be discussing burnout and wellness for healthcare leaders. I'm Dr. Lawrence Yang. I'm family doctor in British Columbia here. And I've studied burnout and wellness in an international setting, including from the Institute of Healthcare Improvement. Today, our objectives are exploring the joint work framework popularized by the Institute of Healthcare Improvement. We'll be talking about personal resilience factors and also systems factors relating to wellness. We'll be creating action plans for personal sustainability if you are a health professional in the crowd. I want to start off because I come from the school of quality improvement, that the quintuple aim, the concept of the five aims that override every improvement project that we do in healthcare. Of course, there's improving health, there's enhancing the care experience for patients, enhancing the care team well-being, and there's advancing health equity, and then there's reducing waste or resource stewardship. So this quintuple aim, along with what some people call the sixth aim, which is planetary health. So these are some of the overriding values or aims that guide all of our improvement and leadership work within the healthcare sphere. And I think aligning your organization to these aims will actually bring more joy to people because it'll be in alignment with their core values. The enemy of improvement and wellness is siloing. And siloing just means that people are disconnected from each other. People are not able to work effectively in teams with each other because of system factors, because of the lack of investment into introducing people to each other. And sometimes it's because of conflicts that keep people away from each other. Judgment, rumors, erroneous blame, things that have kind of separated people emotionally as well. These silos especially contribute to burnout and reduced productivity and reduced performance in the workspace in healthcare. Now, my friends over at the NHS, when I took their training for the School for Change Agents, they defined the ability to make change or the change agency as the power that we have individually and collectively to make a positive difference. And it really is about pushing the boundaries of what is possible, mobilizing others and making change happen more quickly. And I think that's really that it's really key because so often when we are individuals in the system that are not connected, when we are in our silos, we often feel really alone. And change agency really is about building that network of people who are allies in change. So, and a change agent is someone who's actively developing their skills, their confidence, their power, their relationships, and their courage to make a positive difference. So you are probably a change agent. Change agents of the future, as defined by the School for Change Agents and the NHS, what they know improvement methodology, things like the model for improvement, popularized by the Institute of Healthcare Improvement from the 90s, or the lean methods, Lean Six Sigma, DMAIC, define, measure, analyze, improve, and control methodology. They know project management skills. They have innovation and design methodology, things like the liberating structures. And they have analytical and problem-solving skills. They build relationships. They have process facilitation skills. They have coaching skills and presentation skills. How they think in interdependent ways, understanding that everybody is in the system together and that we make up the system. The system is not external to us. They see systems and the patterns and connections, so they have systems thinking. They hold multiple perspectives at the same time, understanding that people have different lenses that they look at the system from. And they understand that people have a trajectory of development as they bring their different perspectives together. They have short and long-term thinking. They are realistic, yet they are unreasonably optimistic. They're comfortable with tensions, paradox, and contradictions, and they think the best of people. You assume positive intent. You have the most respectful interpretation of what you hear so that you don't jump to conclusions and jump to judgments around people's character. The optimism here is something I really want to highlight. We have such low energy in many pockets of our healthcare system around the world right now. People are saddened. There's significant levels of depression and health professionals' sense of futility. So the optimism is so key because it brings an energy, it brings a positivity and a hope. And with today's lecture, we're hoping that you all will experience some increased hope because you might see some things that you haven't seen before. Brene Brown is a sociologist, teacher. She's married to a pediatrician, and she shares a really important perspective that when we dare greatly as leaders in the healthcare, it means that we have the courage to be vulnerable. It means to show up and to be okay with being seen, to ask for what we need, to let people know that when we don't know something, to talk about how we're feeling and to have those hard conversations. Dr. Brown also says that vulnerability is the place of innovation, creativity, and change. And we're in a situation right now where we need maximum creativity and change. We can't stand to, we can't settle for doing things as they are right now. We need as much innovation and creativity as we can. And we have to start from vulnerability, recognizing the truth of the faults within our processes, the faults within our culture, the faults within ourselves. That embracing that there is a lot of room to grow, and that comes with vulnerability. When we think of strength within a system, we don't often think of suicide. And it shows how vulnerable we are as humans, that we can actually come to the point where we doubt our own worth in the system. And this, on a whole spectrum of self-belief as change agents, it links to physician suicide, where physician suicide is where someone who is deeply talented, who has committed so many life hours and sacrificed so much to develop learning, somehow believes that they are not worthy of continuing life. And so we've all, each of us, known people who have ended their own lives because of this challenge. And part of it is our culture in healthcare, and part of it is our individual perspectives of ourselves, and part of it is our society, the culture that of performance that we've become married to. And when our perceived performance drops below a certain threshold, it sometimes reduces our sense of self-worth. Compared to non-physicians, male physicians, and these are studies from North America, we're 1.5 times more likely to kill ourselves. Female physicians are 3 times more likely. Non-binary gender physicians are 3 times more likely. So we have a challenge here for our culture. There's something about healthcare that increases the risks. And some of these stats probably apply to non-physician health professionals as well. In my context in British Columbia, we have the physicianhealth.com program, which is a part of the Doctors of British Columbia program. And they have a 24/7 phone number hotline that any of us can call. I've used this for myself, for my own family's needs, and for my own needs, for my mental well-being. And I trust them. And I encourage you, if you're a physician in British Columbia, to give them a call. If you're outside of this jurisdiction of British Columbia, there are other numbers wherever you are that you should look for to seek help, because again, vulnerability is where we can grow, where we acknowledge and we choose the courage to be vulnerable, and we can come back much stronger. I would like to argue, and one of my mentors, Dr. Don Berwick, says that our default is joy, that we are, as humans, created for joy. But then there's stuff blocking it. Some of these images are AI created, and they might seem a little strange and surreal, and that's just artificial intelligence where it is at this time. Try not to take the images too seriously, but I chose them myself. So our default is joy, but there's stuff blocking it. I, myself, was never trained to offload others' emotions in a healthy way. This is an article from a few years back where I talked about my challenges working in primary care, where I'm an empathic physician and taking on the sufferings of my patients unnecessarily kind of having not as strong of a boundary around what burdens are mine to carry and what burdens are the patient's to carry, and myself stretching myself too far just out of a lack of understanding, a lack of wisdom. And I think so much of the distress that our health professionals feel revolves around experiencing some pretty challenging things through the lenses of our patients' lives. So I think it's important that when we enter into challenging work contexts, and this applies to non-healthcare contexts as well, how do we let go of some of the stresses and the emotional burdens that we experience? And I'd like you to reflect right now how you do that in your lives. What are some of the things that you do? And it can be anything. There is no one way to do this. It's often a combination of ways. How do you let go of some of the emotions that are not yours to carry, that don't serve you, that don't help you, that don't serve your family, that don't serve those that you care for? How do you let go? You might choose to write these on a piece of paper near you or on a digital notepad somewhere. How do you let go? Try to list at least one. Moving on, there's a concept of emotional contagion, and this is just to acknowledge for those of us who have not had the time, the privilege to read about how emotions work interrelationally, that when someone is experiencing something, the other in that same proximity can experience some of that as well. We can call that emotional contagion. So if someone is very anxious, we might experience some anxiety. If someone is very angry, we might start to go into a fight or flight mode ourselves. If someone is very low energy and fatigued, we might actually feel fatigued. There are some neurons that people call the mirror neurons that are partially responsible for this human experience of emotional contagion. Again, these images are artificial intelligence created, and they do seem a little strange. I believe I used the DAL-E engine out of ChatGPT to generate these. But I wanted to find an image that depicted what it looks like for someone to choose what they want to take in. And because I often use meditative breathing techniques, in this image, there's a woman who's kind of breathing something nice in from the universe. And then one can choose to exhale. So breathing in through the nose and exhaling through the mouth, the things that one doesn't need to hold on to. So there's a visualization of letting go of energies that we do not need. So this is just one example of a meditative practice that may assist somebody to work on energetic boundaries, to choose what to let go of and visualize that in our exhales, and to choose what to let in. So this might be a challenging story that we encountered at work, choosing to let go of that challenging story. And maybe choosing to let in the kindness and the generosity and the love that we experience from our friends, from a kind person, from a nice movie that we saw on some streaming service. So we have a choice to create our inner world and our energetic boundaries. Energetic boundaries also pertain, and emotional contagion pertains to the concept of the nervous system co-regulation. We've all experienced how babies and children, when they're upset, they might require the touch of another human or the soft tones of vocal tones of another human in order to regulate their nervous system, to get them from where they are really distressed to more of a calm nervous system. And we have that ability as adults as well, that when we have a calmness within us, we have that ability to calm the storms of another. And we call that co-regulation. Co-regulation. And it is a peer support skill, and healthy work environments have peer support networks. And they may be called peer support networks or they may be called something else, but they are a social connection network where there are people who have the intention to bring healing calmness to others. And I highly encourage those of you who do not have a peer support network to attempt to build one. And Dr. Jo Shapiro, who's an ENT surgeon in the United States, she has developed fantastic change packages around peer support training. And we learned there about emotional boundaries. Moral distress is more of that, the burdens that we carry or the residue of these emotions that we carry when we know the ideal way for some things to carry out, for patients' lives to carry out, for our colleagues' lives to carry out. But when we don't seem to be able to achieve or realize those ideal futures. And there's a distress from that. And there's almost a sense of an onus that we should play a role in making that ideal future come to be. And when it does not, and we feel blocked from that happening over and over, that can be an emotional burden or residue that we begin to carry. A healing modality, as those of us who are healers or who identify as healers, we realize as a reality is that when we work with people who are suffering or traumatized populations, we desire good patient experiences, and we necessarily wade into the suffering of another. We step into that empathic space where we choose to feel the suffering of another, and it can feel like trauma sometimes. And we can experience what we call vicarious trauma. And some literature has written about second victims, where those who experience the emotions of one victim actually carry that and actually experience harm themselves empathically. And we call that the second victim experience, because there is an emotional residue, an energetic residue from that encounter with the suffering. And some of you will know that in order to sustain ourselves in these environments, some of us feel that we need to close our hearts, to armor up ourselves a little bit more, and then we become a little bit unfeeling, or it might be expressed as a cynicism or a negative bias towards patients, almost like a resentment towards the human population for forcing us to experience suffering. But of course, there is no forcing. It is actually our natural ability to feel that we are experiencing, which is very uncomfortable sometimes. So vicarious trauma is a risk that we all have in the course of our emotional labor, which is really what we need to do within healing. In a system, in a health and a care system where we are caring, we will do emotional labor. It's a relational therapeutic work of healing, and emotional pain is a real part of life, and in traumatized populations it might be accentuated. And if we are doing the right things, we will experience vicariously that trauma. There is no avoiding it. It's actually sometimes a necessary part of partnership in healing. The accumulation of these emotional residues and burdens over time, these contribute to burnout in healthcare workers. We can have compounded moral distress, what we just talked about, excessive cognitive load, so real complex problems and a lot of change fatigue and a high volume of patients that deserve good service, especially in Canada, where we do not say no to patients generally when we're trying to take on their care. It can show up as an overwhelmed nervous system in ourselves, as a health professional, as a physician. My nervous system can be overwhelmed quite easily, despite my training, just because of the number of cases that I need to see throughout a day. Many physicians in their clinics are seeing upwards of 50 cases of suffering per day. 50 cases. In the emergency rooms, many of our physicians are dealing with similar amounts or more. And sometimes this overwhelmed nervous system is akin to how complex trauma shows up in a nervous system. So people's cognitive capacities are overloaded, their emotional capacities are overloaded, and sometimes they might feel like they're out of empathy. Dr. Dan Siegel is a psychiatrist, and he explains this concept of the window of tolerance, where there's an ideal window of tolerance. You can kind of see here the yellow section, yellow color, That's when we are at our best. We can deal with whatever happens in life. You might feel pressure or stress, but it doesn't bother us too much. That's the ideal place you can be, where your maximum skill set is available to you because you're in your window of tolerance. But we can be easily shifted into hyperarousal, which is our fight or flight, or into our hypoarousal, our freeze state. Hyperarousal can look like irritability. It can look like people fighting, banging on things, etc., shouting, punching, violence. Hypoarousal can look like being spacey or zoned out, numb, frozen, really silent. And again, these are not intentional. These are just things that our nervous system does to protect ourselves. They are self-protective mechanisms of our nervous system. And we have the opportunity actually to widen our window of tolerance through various self-care and meditative practices, but it can be anything. When we are outside of our window of tolerance, we often see what we call exhausted leadership or burnout, where there's a lot of cynicism and there's blamefulness. This is a blame thrower. I made this. This is not a chat. This is not an AI image. I manually constructed this image and I'm very proud of it. This is blame throwing and this is gossiping. These two actions, blame throwing, gossiping, creating rumors and blamefulness, these behaviors are the most corrosive behaviors to well cultures, to compassionate cultures in healthcare. And there's no blame around this. This is simply because our nervous systems are outside of our window of tolerance, where we haven't recognized that our nervous systems are overwhelmed. We haven't recognized the trauma that we have experienced, and we are just being what we are being. We are leaking out the energy that we have taken onto ourselves, and different is possible. When Resmaa Menakem is a poet, and they wrote this very insightful poem that trauma in a person, when we decontextualize it or disassociate it over time, it looks like personality. And trauma in a family, decontextualized, it looks like family traits. Trauma in a group of people, maybe a healthcare culture, decontextualized over time, it looks like culture. So spend a moment to meditate on this wisdom from Resmaa Menakem and see, does this resonate with you? Are you working in a culture that has been traumatized? And maybe we're not identifying it as such. Maybe we're just saying, this is just how the culture is. Our culture is toxic. But is your toxic culture a traumatized, a hurt, a wounded culture? There's a saying that hurt people hurt people. And also, people who have done healing definitely can heal people as well. So in the reality of these dualities, hope is there, that post-traumatic growth is possible, that resilience is real and resilience is possible. Again, our default, I believe, really is joy. And again, there's stuff blocking it, and some of that stuff is what we've just discussed. Trauma, when it's decontextualized, it shows up in many different ways. Jay Stringer wrote a book called Unwanted, and some of us carry narratives, traumatic narratives from our childhood wounds about being unwanted. Sometimes this shows up in our work. Trauma can look like we're holding an umbrella open above our heads, even when there is no rain. So this speaks to that self-protective behavior, not opening our heart behavior because we've been hurt before, or not choosing to build any further relationships because of how we've been hurt. We're protecting ourselves when there is no rain, when there is no ill will, when all the will is actually good and benevolent, but we're still protecting ourselves from each other. That's what trauma shows up as. We see this so commonly within healthcare professionals and healthcare leaders. We have this individualism that's just not serving us. but we are too afraid to open our hearts again. Sometimes it's the woundedness that comes from a broken, intimate relationship, and that can spill into the workplace. So trauma increases vulnerability to confirmation biases. It can show up as less curiosity in our members. And we find that when we've been hurt, we need to be right, because being right gives us a sense of control. We need to be right more than we want to see the nuance. Sometimes we'll discount all the goodwill that is actually being shown to us and just hyper-focus on some of the hints of imperfections in others. We'll hyper-focus because there's that, when we have the pretense of knowing, when we pretend that we know what's going to happen, that we can read the future, it gives us a sense of control. Trauma increases fast-paced misrepresentations of people versus actual multidimensional, nuanced appreciation of people. We can just see a small part of someone and say, oh, that person is a bad person. That person's not to be trusted. But actually, we're all complex beings, each one of us. And we can't say what type of car it is from just looking at the wheel. We can't say what type of car it is just from looking at the steering system. We have to recognize our bias for reductionism. And again, being burnt out or being hurt is not our fault. We are humans working many, many hours in a system that's inadequately designed. There's some of us who work up to 100-hour weeks, which is amazing and not always the best. Doesn't always serve people for you to just put a lot of hours in. It's really about that quality. Is the quintuple aim being met? Sometimes we call that a shitty system. There's a group in British Columbia called Switch BC, and they had a Dr. Wendy Dean come and present, and Wendy Dean presented this quote from Ed Yong that was published about 4 years ago in The Atlantic. It says, healthcare workers, they aren't quitting because they can't handle their jobs. They're quitting because they can't handle being unable to do their jobs. That means that they have all the ability, but there are system factors that are preventing them from executing and to achieving those quality experiences that they really want, that they got into the work of healthcare to do. One of my teachers, Dr. Paul Batalden, he says that every system is perfectly designed to get the results it gets. And this actually gives me hope, because if we're achieving poor results for patients, if patients are being harmed by healthcare, and one of the publications from over 20 years ago said that out of every 100 people who come into the healthcare system, at least 13 of them are being harmed. So 13% harm. It's because our system is designed that way. And it's not blameful of humans individually, but humans are part of the system. How we train humans, how we design decision-making protocols for humans, that is part of our design. Because the health system is not just clinical operations systems, it's actually a cultural system as well. And the cultural system is the rituals, the stories, and the consequences for violating the values of our culture. I'd like you to reflect right now, what are some of the stories that you tell yourself in your culture at work? What are the narratives that guide your thoughts and behaviors in your health system? Maybe write some of that down on a piece of paper right now. I'll give you a moment. You might pause here if you have more time, if you need more time. Some of the cultural narratives that are common to where I work in North America are that asking for help is a weakness. And that's in a culture that's more conducive to distress, that's the narrative. Asking for help is a weakness. But in cultures more conducive to healing, we recognize that everyone needs help most of the time, and it's normal. And many of us don't have the access to multi-generational families, like maybe humans had centuries ago. We don't have that access. So it's challenging to get the help that we need. It really requires villages to raise humans in a healthy, minimally traumatic way. One of the other beliefs that is more conducive to distress is that only I can do the job. If I don't show up, people will die. And some of you might actually feel that's a very true statement. Hopefully we can get to this narrative that if I'm not there, someone capable will help in my stead. They might not do it exactly as I do it, but they will help. And people do not or will not have to die. That there are others who have the combined skills, the complementary skills to keep people alive. There is the narrative that is conducive to distress that a good health worker sacrifices their health for others. But in a culture more conducive to healing, a good health worker models wellness and sustainability. There's the narrative that my self-worth comes from helping others. But in a more healthy narrative, I might point in directions that help, but people choose their own happiness. It's not actually me that's rescuing or saving anybody. My self-worth is intrinsic. It's unrelated to anything that I do. My self-worth, your self-worth, is intrinsic to you and is immutable, unchangeable, unlinked to what you do. A cultural narrative that's more conducive to distress, I must rescue people. You can kind of see the ego that's tied into that. The belief that you have the ability to rescue people consistently. In a narrative more conducive to healing, all people are capable to lean into their own power. My desire to rescue might not always be coming from a healthy place, and my overreach might have unintended harms. And lastly, my mentors, those who I learned from, my preceptors in clinical work, they didn't self-care. I don't need to self-care, or I don't deserve self-care. But the truth is that we all need empathy preservation methods. We all need them. An inspiring talk at an Institute of Healthcare Improvement conference that I'd heard before from Dr. Rana Oddish, who's an intensivist. She said, don't believe the lie. Don't believe that you have to change yourself to fit the culture of medicine. Just be yourself. Let medicine move to fit you. Because more than likely you are healthier and more whole than medicine is right now. So this is encouraging you to be a positive deviant, a deviant towards the future of sustainable healthcare professional living, a future of sustainable healthcare culture that we need. Here's a moment for you to reflect on what does wellness mean to you. Maybe write down the different aspects or the domains or the pillars of wellness. What are some of those things? Physical comes to mind for me. What comes to mind for you? Maybe pause the video and write down, what are your categories? Come up with at least 6, if not 7, 6 different categories of wellness that would fit into your definition. Sometimes you can think of these as the energy bars that you would need, that can be whittled down, but that you could also fill up to do the things that you need to do in your life. Go ahead and pause and write those here, and then we'll continue in a moment. All right, I'll be advancing now. Hopefully you've written down those different buckets of wellness. Some of them that came up for me were physical, emotional, intellectual, occupational, financial, maybe environmental, and even spiritual. Those are the ones that came up for me, but you can have more or less. This is my personal definition of wellness. It's a spiritual and relational and emotional wellness. That means that one has sufficient reserves of empathy within us so that we might behave in alignment with our core values, so that we have enough reserves of empathy so that we can behave in alignment with our core values. And for me, some of those core values are caring and love. And do I have the empathy within me to be loving to my family, be loving to my friends, be loving to my children? Physical wellness, sufficient time devoted to self-care, that we can experience joy in movement. Sufficient time devoted to self-care such that we can experience joy in movement. Physical wellness. Financial wellness, sufficient funds such that one is readily able to consistently access a mindset of abundance and gratitude and safety. I didn't say anything about mansions or luxury cars. It's just sufficient funds that we can access a mindset of abundance and gratitude. Financial wellness. These are just things for you to consider. This is purely my opinion. These are just my opinion. When wellness feels far away, where do we start? And starting with ourselves, our harsh inner judge, harsh inner critic. Sometimes my inner voice has said, you can't do that. I can't do that. I'm not perfect. I'm making too many mistakes. I'm not good enough. Nobody loves me. Everybody hates me. Sometimes our inner voices can do that. When wellness feels far away, we can start with self-compassion, having empathy for ourselves. These are the three major flows of compassion: for self, to others, and from others to self. We should expect some of that. For those of you who have a spiritual or theistic worldview, the Creator is actually able to send compassion or empathy towards you and to others as well. And that really helps, where it doesn't have to be a limited, zero-sum game. There's another source of energy coming into the system. Self-compassion can be defined as a mindfulness, a non-judgment, a suspension of judgment towards the self, just like you suspend judgment towards others. Self-compassion also has a self-kindness, speaking to ourselves, like we might speak to a good friend of ours. We wouldn't be very harsh with a good friend of ours if something didn't go their way. We would be comforting towards them and speaking to ourselves in a comforting way. So for some of you, this will be very foreign. For some of you who grew up like me, using violent words towards ourselves to try to prompt more performance is what we were taught. That's the neural grooves that we've been shown. But what if we started to choose a different way of speaking to ourselves? If we were more kind to ourselves, would our performance actually drop? Or might it stay the same? Because maybe we are still geared towards excellent performance and quality performance. But we might just save ourselves some energy from beating ourselves up, from being violent towards ourselves and putting ourselves outside of our window of tolerance. Something to consider. There's also common humanity, which is part of self-compassion, which just acknowledges our vulnerability as humans, that we will make errors and that is completely normal. And having compassion for ourselves, having kindness for ourselves, even when we make mistakes. A resource for self-compassion development is Dr. Kristen Neff and Chris Germer's book, and they teach from almost a Buddhist perspective some of the meditation around wishing oneself peace, happiness, wellness, and safety, and reduction in suffering. And it's often done by just putting a hand over the chest, having that tactile feel of the warmth of one's hand on their chest and saying, may I be peaceful, may I be happy, may I be well, may I be safe, may I be free from suffering. You can go ahead and try this. May I be peaceful, may I be happy, may I be well, may I be safe, may I be free from suffering. And then we can hold our hands outwards towards each other. May all beings be peaceful, may all beings be happy, may all beings be well, may all beings be safe, may all beings be free from suffering. As you can see, some of this is not based in logic. We won't be able to reduce all suffering or eliminate all suffering, but it can be reduced. And that's actually the desire of someone who has a heart for healing. Distress and burnout and our vicious cycles. We have complex work demands, those demands that really drive up our cognitive load. We have suboptimal process design. Our system is perfectly designed to achieve the results it gets. And then we have certain inner narratives or team beliefs. One of those team beliefs sometimes is that martyrdom is necessary for things to happen. And this is as you can see, this is a function of a poorly designed system. Because the system is not adequately designed, individuals within the system feel like they need to force themselves, to stretch themselves beyond what's humanly sustainable to try to achieve results that are not sustainable. So I'd like to propose that martyrdom is not part of your job description wherever you are in the system. It is not helpful for you to hurt yourselves and harm yourselves in the process of trying to deliver care, because it creates a net negative in our system. No one really benefits. It is a cognitive distortion. Some pure narratives that I hear when I do my talks around the country around burnout is that I see what you're saying, Lawrence, but I'm stuck on this treadmill of work. The system is inadequately designed, but I'm a person of integrity, and I already committed to do the 100 hours per week, and I can't stop. I can't get out because then I'd be going against my promise. I'm only as good as my word. If I stop, then everyone will stop. Some of the beliefs are, I cannot abandon my colleagues. I cannot abandon my patients. My identity is all wrapped up in being a responsible doctor, nurse, clinician, healer. What does it mean about me, my self-worth, when I say no, when I stop being a doctor? If any of this resonates with you, I encourage you to take a moment. I invite you to reflect on the truth and maybe some of the untruth in those statements. This is a list from Dr. Brene Brown of different values, and I invite you to pause now and try to select your top 3, your top 5 values. I think being clear and explicit on our top 3 and 5 values is very, very helpful. And you could choose your whole life perspective for this, or your work perspective, your work context perspective. And what this allows you to do is know what is really core to you. What is necessary for you to be in alignment with your values, in alignment with your joy. Go ahead and pause, and you can press play again once you've identified those 5 values. Okay, hopefully you've identified those 5 values, and that'll allow us to move forward. Because when we are self-compassionate, we actually create energy and capacity. We start to take different actions that preserve empathy. And then we can lean on our other resilience factors, such as having a well partner. What a privilege to have a partner who's well. have funds for wellness activities, job stability, secure housing, children who are joyful, access to books, recreational activities, sports. We can pair our self-compassion where we're taking care of self, leaning into some of these privileges that we have in our lives. And then we can set even more empathic preservation. Self-compassion preserves and cultivates empathy for others. It absolutely does. Leaning into our privileges and accessing our resources builds empathy capacity for others. And I'd like you to consider now what empathy preservation boundary you might set for more sustainability in your work. And this is what some empathy preservation statements sound like. Number one, I know that access to our team is important to you. I need space for my own wellness. My team is here to help you. So not me individually, but I have a team. Imagine that, having some redundancy in your services so that you can delegate to your team members. Number two, I understand that you're upset with what's happened. I'm not okay with you speaking to me rudely. I'm going to leave now, and we'll continue this later. It feels probably uncomfortable to some of you who are working in a silo and just so used to just being just you, maybe people pleasing. Number three, you and I see things differently. I need some time to tend to another matter. We will schedule another time to discuss this further. There are no rules that you have to stay in a particular challenging, unhealthy environment all the time. You as a human, you have the right to schedule things. You have that right. I know we're short-staffed, but I will not be putting in more time. I want to help the team, but stretching myself is not sustainable at this time. It's just true. It's just facts. I won't be doing these shifts. I'm putting my health first for the next while. That's powerful. I recognize that leaves you with having to find coverage. Again, if the system has not been designed adequately, you martyring yourself for the system, it's not going to change very much. You're just you. You're just one person. A wonderful person, but you're just one. Number six, I really want to be helpful, but I am at my limit and I need to rest. Thank you for understanding. Number seven, I will not do that for you, but maybe I can help you in this other way that's in alignment with my professional values. Number eight, I've overcommitted myself. I need some time for me right now. Number nine, that is so thoughtful of you. I'm not interested. Number 10, we will discuss this in private at a later time. And number 11, my favorite, no. No is a complete sentence. So in your boundary setting, you actually can begin to select what experiences you want to take onto your life and what you need to let go of. And I encourage you to take some time to reflect on what needs to be given up, what needs to be pushed a little bit outside of your life right now to make space for what really matters to you. Go ahead and pause the video now and write down something that needs to be pushed out. It might be a work thing, it might be a particular colleague, it could be a relationship, it could be a habit that you have, a coping mechanism that you have that's harming you. It could be a substance, it could be an internet-related thing. It could be something that feels spiritually incompatible with your ideal vision for you. Take some time right now, pause the video, to write down what that might be. Okay, I hope that you've had some time to reflect on what new boundary you'll be setting for yourself. And you can be as specific as you want to around when you'll make this boundary. And if you'll need an accountability partner, who you might engage, who you feel safe to share that boundary with. And I encourage you to do that when we have accountability partners, because we are just human. Teamwork is helpful in boundary setting as well. With these principles of healing ourselves, creating healthier boundaries, preserving our empathy, when we come into our teams, we will notice that our team functioning is better. And then our community at large, because we are the system, actually improves as well. There is the IHI framework for improving joy in work. This is a recommended reading. And what we've talked about today really sets us up for the excellence that is within this document. And I will review some of the highlights right now. And positive leadership qualities of the physician leaders influence the well-being and engagement of individual physicians. So the leaders really matter. And a leader is not a judge. A leader is a coach. And a coach recognizes that people are born with intrinsic motivation. They are actually aligned to do good work. They have the inclination for self-esteem, dignity, and the curiosity to learn. And they have joy in learning. This is a statement from the Deming Institute, and that's a photo of William Edwards Deming. He passed in '93, but he was foundational to some of our quality improvement leadership work. And he's reminding us that people want to do a good job. And so we're actually working with assets. We're working with strengths when we're working with people. So let's try to pull back some of our negative biases towards our team members and actually look at their strengths and recognize that they actually want to improve. And a coach is not a directive role. A coach is a role that finds strengths and encourages strengths to blossom. And when there are lack of strengths, a coach finds the complementary strengths within the network to fill the gaps. And there's formal and informal leaders, and both of formal and informal influence culture. So mapping out your network of influential people on your team, that is so key for your success. If you're bringing about any changes, any shifts in culture, find your influencers and have some good heart-to-heart discussions with them. Michael West out of the King's Fund, he shares that compassionate leaders create virtuous cycles of compassion. That means that kindness and attunement, connection between people can facilitate kinship and more virtuous cycles of kindness throughout the system. When we're really aware of our personal values, we can then connect to purpose, and then we can create team vision of where we're going in the future. Michael West says that the core skills of compassionate leadership are choosing to be proximate. So if you're leading in your system, choosing to be close to those you lead, choosing to feel, which is empathizing, choosing to understand, not to reload or to argue or to rebuttal, and then choosing a team-based action or team-based helping, which is more sustainable than a singular person acting. So that's compassionate leadership, and it crosses silos, those silos that we mentioned. These are some of the pillars that can be facilitated by leaders in your system. Physical and psychological safety, a connection with purpose, so people are getting feedback loops about their work and ensuring that those feedback loops tie into some of their core values, what matters to them. Having what matters to you conversations are so important to find out what people's purpose is. Increasing a sense of autonomy. Are the staff empowered to improve their own processes? It's not about ego and top-down control and leadership. It's about participative management. C is a sense of community. Do teammates feel seen? Do they feel they belong? Are they being recognized for their contributions? And E, sense of equity. Is there a due process in decision-making? Is it clear how decisions are being made? Is there just culture? In just culture, we talk about the intention behind humans who are associated with errors or harms in our system. And we base our sanctioning on whether or not there was full intent in harm, or if there was just risk. We coach. We really focus on coaching and consoling, especially when it's just human error. So look into just culture. Definitely look into ways to generate feedback loops, participative management, having people co-create solutions, bringing people together across silos. And that's the work of compassionate leadership, to generate conditions for joint work. So it all starts off with asking what matters to you, and then you identify the impediments to the joy and take a systematic approach across the entire system, where leadership has common shared values, and then using improvement science or PDSA cycles to reduce some of those frustrations that are blocking joy from happening. These are the virtuous cycles that we talked about, where kindness directs attentiveness and it enables attunement. It builds trust, which generates therapeutic alliances, which produces better outcomes. And this reinforces kinship and it promotes kindness again. This is Penelope Campling's work out of the NHS. When we lead for joy, we understand that we have formal structures and corporate structures which are necessary, but we also have the informal networks where a lot of the influence and culture is happening. And I would argue that it's equal as important to focus on the formal networks and the informal networks. Managing in the absence of typical chain of command is a craft skill that relies on trust to make reciprocity do the work of hierarchy, a give and take, relationality. Reciprocity can also be described, and this is from Robin Wall Kimmerer, Indigenous writer in Canada, that people weave a web of reciprocity, of giving and taking. In this way, the trees all act as one because the fungi have connected them through unity and survival. All flourishing is mutual. Soil, fungus, tree, squirrel, boy, all are the beneficiaries of reciprocity. So the siloing is not helping. The classism's not helping. And it really is that connection, the human connection and the relationality that will bring us forward to a better system, a better health system. There becomes a joy when we know the strengths of our people. And we used to all try to group people based on similarities. But in a system, we group people based on complementarity, how they fit well together, the synergisms, the synergies that come out of combining people with different skill sets and diversity. So focusing on complementarity is very important. In our discussions, focusing on having brave spaces where we can have controversy discussed with civility, where we can distinguish between ideas and people. We don't attack people, we can critique ideas, but accept people the way they are. Where we can take care of ourselves, where we own our intentions and our impact, where we can have controversy again with civility. Brave space is what we're aiming for. And leading in the context of blamefulness and gossip, it's so important that we choose not to be a part of that blamefulness and gossip. In complex systems, blaming one person is illogical and erroneous. So if you're someone who likes logic, you ought not to do blamefulness in complex systems. That behind every criticism is a veiled wish. As you lead, you can kind of, if someone is saying, you're a bad leader, behind that, you're a bad leader, we can have a curiosity about what is it that they're actually wishing for. And sometimes, almost the majority of times, they just want to be heard. They want the leader to be proximate, to listen. They want to be felt, to be understood, to be validated for their suffering. And when we choose as leaders to be closer and to explore how that feeling is, we will naturally be driven to make changes, to facilitate changes within the system that will ease some of that suffering. We have the opportunity as leaders to identify the unmet needs in ourselves as we grow in self-compassion. And then when we have enough capacity within ourselves, enough preserved empathy, we can turn towards our teams. We can see that sometimes those unmet needs are, I'm not being heard, or I'm not being recognized, I'm not being treated fairly, I'm tired, I'm in pain, I'm in distress. And we can offer some of those solutions. Go ahead and pause here to reflect on each of these if you'd like. I want to thank you for your time today. Sharing time like this, almost an hour, is very rare. And it's been an honor to share this work with you. My email address is gatewaymedic@gmail.com. Join the resistance, because a joy in work is an act of resistance. I've been Dr. Lawrence Yang, family doctor in British Columbia. Appreciate you.